If you've had back pain for months and your MRI says everything looks normal, but your pain is very real, this might explain it. What if your back pain isn't coming from a disc problem at all, but from damaged soft tissue that never fully healed? Because here's something many people are never told. Not all back pain is structural. And in many chronic cases, especially lower back pain, the real issue isn't what shows up on imaging, it's what's happening in the soft tissue around the spine. So today, let's talk about shockwave therapy for chronic back pain. And more importantly, who it actually helps. Here's what most people think when they feel back pain. Back pain equals a disc bulge. Back pain equals arthritis. Back pain equals something serious. And while those things can absolutely be involved, they're not always the full picture. Because in many long-standing cases, the real issue is soft tissue dysfunction. We're talking about things like degenerated fascia, tight fibrotic muscle tissue, chronic trigger points, scar tissue from old strain injuries. These tissues play a huge role in how your spine moves and feels. But here's the problem. They have poor blood supply, which means when they get injured, they don't always heal properly. So instead of recovering, they become stiff, restricted, and painful. This leads to what we call a failed healing cycle. Pain that lasts longer than 3 months isn't always active inflammation anymore. Often it's tissue that's simply stuck, not fully damaged, not fully repaired either. And this explains something many patients experience. Stretching helps temporarily, massage feels good for a day or two, adjustments improve movement for a short time, but then the pain comes back because while those treatments address symptoms, they don't always stimulate actual tissue repair, and that's where shockwave therapy starts to make sense. Shockwave therapy, also called extracorporeal shockwave therapy, uses acoustic sound waves delivered into tight or damaged soft tissue. For back pain, we typically target areas like chronic lower back muscle tightness, thoracic spine stiffness, myofascial trigger points, side joint ligament irritation, scar tissue from previous injuries, and this is important, it's not used to treat disc herniations directly, it's used to treat the soft tissue dysfunction around the spine. So what actually happens inside the tissue? The acoustic waves increase circulation, break up fibrotic adhesions, stimulate collagen repair, and help reset chronic muscle guarding. Think of it like rebooting frozen tissue. Instead of just relaxing the muscle, it stimulates a healing response. During treatment, you'll feel rapid tapping and deep pressure over tight areas. If you have trigger points, it can feel intense for a few seconds. Sessions are short, usually around 5 to 10 minutes per area. Shockwave therapy works best if your pain is muscular, it's been there longer than 3 months. Imaging doesn't fully explain your symptoms. You feel tightness, stiffness, or deep aching. It's especially helpful for desk workers, athletes, postural strain cases, people with recurring flare-ups. Here's the part that really matters. Shockwave therapy alone is not the full solution. If you don't address posture, core stability, hip mobility, movement patterns, stress that caused the problem keep coming back. So while shockwave can help restart the healing process, rehab is what helps keep it healed. If you've tried everything for chronic lower back pain and nothing seems to stick, it may not be your spine, maybe your soft tissue. If you want to find out whether shockwave therapy is appropriate for your back pain, book a consultation or DM us the word FLOW. And follow for more non-surgical back pain solutions, because living stiff and guarded, it isn't normal, even if it's common.